Good afternoon, everybody. I'm Dr. Morrow. I'm here. I'm with American Mood Swings, and we're here with Dr. Keifer from Brain Health Hawaii in Honolulu, Hawaii, and Angela Keene, his medical marketing professional. And we are going to discuss electromagnetic stimulation. So thankful that you're here with us today.
I really appreciate you having us.
So you mentioned when I was looking at your website, the functional brain assessment. So is that the cap you were describing when you're measuring the activity in lieu? Because some of the videos I had when I was researching showed like a lot of clinics do like a pre-MRI and then a post-MRI.
Right,
So that's not being done. It's all through this cap. Is that the functional brain assessment?
right. Yeah, so one thing to think about it, MRIs, CTs, these are very helpful studies to be done in certain situations. And certainly in medicine, we use them to rule out, um, you know, certain things that we would want to be concerned about. But for most of the sort of neurocognitive, neuropsychiatric, and even some neuromotor conditions, and certainly concussions, most people have normal anatomy, right? So you think about MRIs and CTs and things of that nature. Those are anatomical tests, you know, the brain at that particular time. And what we want to see is what are the actual functional communication patterns, right? So the brain,
yes.
think of the brain like a 90 billion neuron orchestra. And we think that each neuron has about 10,000 connections. So it's a pretty intricate, delicate web or network, like a hard drive, like a computer. And so to the extent that all these regions anatomically are okay, which they usually are, and most people that have concussion, anxiety, PTSD, depression, we're now able to see, okay, anatomically they may be okay, but in terms of the neurons talking and communicating and playing together in an efficient manner, that's what's off. So we're looking at the neuroelectrophysiologic patterns.
Okay. Very different. Yeah.
So we're able to assess it and then treat it. And then as we're doing treatment, after every 4 to 6 treatments, we continue to reassess the brainwave patterns and alter and adjust accordingly.
Okay. Are there any contraindications, people who could not, where it wouldn't be a good candidate?
In general, we want to be careful if folks have metals in their head that are iron-based. Other contraindications would be a recent seizure. We have used, in some cases, our approach to treat people that have a history of seizure. So it's important to look at the timing of that, if they've had a recent seizure or not. And there are some other sort of rare contraindications, but for the most part, it's well received, well tolerated. We're using a low dose of energy, to kind of give people an idea of what I mean by energy. Standard MRI uses 1.0 to 3 Tesla of energy. So if you're in an MRI, sometimes you can kind of feel that.
Okay.
We're actually using 0.1 to 0.2 Tesla of energy, but very low, which again, we found that being precise is more important than delivering extra power, as you essentially help people to realign and make their brains more efficient, because when you do so, most people perform in multiple domains so much better than they did prior to treatment.